Tamara, and welcome to my YouTube channel. Today, we're going to talk about the differences between obsessive compulsive disorder and obsessive compulsive personality disorder. There are two different things. Oftentimes in our society, people will say, I'm OCD. And when they say that, they're either leaning towards one of the disorders or the other one. So for example, if someone says I'm OCD, meaning I'm meticulous, I'm perfectionistic when it comes to my work, I expect a certain standard when someone is working for me, I want my things to be done a certain way, that description leans towards obsessive compulsive personality disorder. But if it's someone who's saying, I feel like I'm OCD, meaning I use hand sanitizer a lot because I don't like germs, or if somebody touches my food, I can't eat it after that because I don't like germs, that would be more so obsessive compulsive disorder. I think when people are using those terms, they feel like they have the tendencies, and they might, but usually my thoughts about that person is, I don't think that you truly have that disorder. So I'm going to attempt to explain what those disorders really look like and give you some clarity on what the difference is between those two things are, because they are different. When someone has obsessive compulsive disorder, that's more of an anxiety disorder. When someone has obsessive compulsive personality disorder, it affects the personality, the skeletal makeup. So when someone has obsessive compulsive disorder, they have a lot of anxiety. They have a lot of intruding thoughts that are entering into their heads. What stands out to me about someone who has obsessive compulsive disorder is they can hide it. And you would never know that they even have the disorder because you don't see it manifesting in their personality. So look at Howie Mandel. He is a perfect example of someone who has obsessive compulsive disorder. He's very lively, he's energetic, he's got a lot of personality, he's friendly, he's funny, he's very outgoing. The disorder does not impact his personality whatsoever. You wouldn't even know that he had it if he never shared it with you. So you can't see it manifesting. For example, I had a lady at work. She said, can I ask you something? She said, is it unusual that every morning when I comb my hair, I have to comb this side 45 times and then I have to comb this side 45 times? It's more of a compulsion. So they may have to always take their first step out of bed on the right side of their foot, or they may have to close the door 5 times before they leave in the morning. Or there are times when all of us experience some level of anxiety where we have to go back and we think, did I let the garage down? And yes, people with obsessive compulsive disorder may go back 5 times to check to see, did I let it down? Did I let it down? Did I let it down? They may have to arrange their plate of food in a certain way, like nothing can touch each other, or maybe if they're cooking something, they have to stir it the same amount of times every time. I mean, they sort of have these rituals or these routines that they have to do. It's a lot of intrusive thoughts that they can't control that are telling them that they need to do certain things. It's not the same thing as voices. It's more thoughts. And if I don't play these thoughts out, something bad could happen. They can be very routine in exactly how they have to do things. Counting can be very big in this disorder, where they're counting the number of steps, or they're counting the number of times they're washing their hands. Germs can be a component of this disorder. They definitely can be really terrified of germs. It could cause them to wash their hands and then wash them again and wash them again, even though they haven't touched anything else, because they're afraid that maybe I didn't get the germs off. So it's compulsive. I don't know if you should feel sorry for people, but I have great empathy for people who have obsessive compulsive disorder because it's psychologically draining and exhausting. It doesn't impact the personality. Now, they can get treatment for it. That's the great part about it. There's medications that can help to calm that down so that they can live a more normal lifestyle. Let's talk about obsessive compulsive personality disorder. That is going to greatly impact the personality. When you're working with someone who has a personality disorder, if you're friends with the person, married to the person, you have interactions with the person, there's always going to be difficulty with working with that person on some level. There's going to be an area that is really hard to work with. That's how you know it's more the personality, because they're gonna do something that's gonna greatly offend you, or they're gonna do some things and insist on them. So people that I would guess have obsessive compulsive personality disorder, just to give you a clearer picture of what that looks like, would be Kate Gosselin from John and Kate Plus 8. She has 8 kids. And that obsessive compulsive personality disorder definitely comes in handy because she's very rigid, extremely rigid in how she does things, extremely rigid in her systems. Another person would be Martha Stewart. She's very rigid and exacting on how things should be done. They must be done a certain way, and you can see it impacting her personality. I recently watched an episode of Martha Stewart where she showed different strains of wheat and how they were broken down into the flour that we use to bake things before she proceeded to make a recipe. While it was extremely interesting, people who have obsessive compulsive personality disorder have a preoccupation with details, rules, lists. They have an excessive devotion to work and productivity, reluctance to delegate tasks or to work with others unless they submit to exactly his or her way of doing things, and they show rigidity and stubbornness. I remember reading a book about her once and how difficult she could be to work with, but then at the same time, having that personality disorder, which is my guess, has benefited her brand greatly. The other person who I think could possibly have this personality disorder would be Dr. Laura. I notice with her phone calls, if they don't explain to her in the exact perfect way what the problem is, she goes off or she starts getting angry. Most people find it challenging to make decisions when it comes to a moral dilemma because most people think in gray, which is a healthy way of thinking. Many people contact Dr. Laura because she does something called splitting, also called black and white thinking or all or nothing thinking. The individual tends to think in extremes. For example, an individual's actions and motivations are all good or all bad with no middle ground. When you think of the personality disorder, it's the rules according to me. So these rigid, strict rules that must be followed at all costs cannot deviate from these people's rigid, perfectionistic, impossible unless you are a robot to follow rules. These rules are according to what's in their head. It's according to that person. But it's almost written as though it is the Bible. It is sacred. It is a must. There must not be any deviation from these rules, or it causes great anxiety in the person with that personality disorder. They may start to lash out, get angry, become very frustrated, refuse to work with you, be very critical, criticizing. They can be hard to work with because you're gonna have to walk on eggshells with getting things done exactly as they say, or you're gonna feel the punishment of throwing things off balance. They can be very, very stubborn when it comes to how things should be done. They believe the way that they're doing things is always the correct way, always the right way to do them. They can be very inflexible and rigid when it comes to their morals, their ethics, their values. There's not much room for not following things exactly. They are extremely controlling and perfectionistic, and the rules must be followed no matter what. So it's about control. And when you start messing with how they have things laid out and how they are controlling things, you're gonna trigger them to really, they're gonna give you an extremely hard time. It affects their personality, and you can see it, you can feel it. Now, they can have some issues also with germs and feeling, like things are icky, but they can be very squeamish and freak out about germs as well. I believe that hoarders can be diagnosed with the disorder as well. I would think that it affects their personality a little bit more. A lot of times people with obsessive compulsive personality disorder can't throw things away. They have to hold on to them. That's very, very difficult to do. One interesting thing about OCD personality disorder is that they do want to care about people. That's the good thing. They do have a conscience for people. They do have compassion. So it's not that. It's just they are very, it's got to be exacting. But like I said, there are some famous people who I would guess have the disorder because it impacts their personality and how things are done. It has helped them to be extremely successful. Some people may know that there's something a little bit off in their personality, and then others think, no, my viewpoint is exactly right and everyone needs to follow it, and they have no clue that they're displaying traits of the disorder. So I don't know, I find it interesting, I find it fascinating. I think the more that we can educate people and educate ourselves and get the diagnosis right, then we can help people who really need it to live a more fulfilling and happy and peaceful life. That's always the goal. So I hope you learned a little something today. If you enjoyed my video, please give me a thumbs up and also subscribe to my channel so that you can see more things about psychology and counseling and all that good stuff. Thank you for watching my video. Bye.